The change of season brought hope of some freedoms, but with 120 new cases, the biggest spike in Victoria in over a year, those hopes were dashed.
There's going to be very significant restrictions. A lockdown in some form is going to be there to contain cases until we get the vaccination rates as high as possible.
But the mental toll of lockdown 6 has been recognised. Playgrounds will reopen on Friday for children under 12, but parents must check in with a QR code and they're not allowed to take off their masks to eat or drink.
Because then we can go out and play at the parks and have more fun.
Yeah, with homeschooling and having all the kids at home, it's being able to get out and use some energy, and it just makes for a happier day.
The majority of restrictions are here to stay until 70% of Victorians have had one dose. It's estimated we'll hit that target on the 23rd of September. That's when the 5 kilometre limit will be expanded to 10 kilometres. You'll be allowed to exercise for an hour more each day, and outdoor personal training will be allowed for 2 people. But even then, the curfew and stay-at-home orders will remain.
It was supposed to be D-Day. Well, D stands for devastation. D stands for despair, because that's what Victorians are feeling today.
Absolutely, it's tough, and 3 weeks seems like an eternity. That light at the end of the tunnel is too dim and the tunnel is too long, but it is a light at the end of the tunnel.
That light is closer for regional Victoria. The lockdown will likely end next week everywhere but Shepparton.
Albeit still with significant restrictions. It will not be a full opening up. There will not be hundreds of people at the pub or the restaurant or the cafe.
VCE students and teachers will get priority vaccinations at state-run hubs from next Tuesday. Schools will not be back for Melbourne students this term, but a plan for term 4 will be announced next week.
All we want is a sense of certainty, and as long as the government gives that level of certainty, we can work within that.
But with no date for hospitality to reopen, struggling business owners like this one in Altona North say they may not last much longer.
3 years ago, my business was worth something. What's it worth to me now? I don't know. It's grim.
Our small business owners and our female community leaders are at breaking point. Their mental health is severely impacted.
The next big changes will come when 70% of Victorians have received both doses in line with the national plan. That's not expected until the end of October. Many Melburnians are likely to be under some form of lockdown until then. Bridget Rollison, ABC News, Melbourne.
Melbourne Town Hall is one of the city's most recognisable landmarks. Now it's a vaccination hub. The drop-in centre is dedicated to helping the homeless, refugees and international students.
A lot of them might not have Medicare cards or ID or don't have phones or computers that make appointments or stuff like that.
I just hope that I can get the vaccine to get this over with.
1, 2, 3. Town hall nurses will soon be able to vaccinate up to 600 people a day.
When we can take the vaccine to the people, rather than asking people to come to the vaccine, we should see increases in vaccination rates.
2 Melbourne women who died in their homes from COVID-19 earlier this week weren't vaccinated. The ABC understands the women are Eritrean.
It's tragic that we've had 2 deaths, our first deaths so far this year.
Doctors say COVID-19 can lead to heart complications.
So I would suggest that would be the most likely cause here. I don't suggest this is a common way of people to pass away with COVID.
Paramedics were sent to the Northcote home of one of the women the morning after she died to help someone else, but didn't know it was a potential exposure site. Their union wants a better system so paramedics know if patients have COVID-19.
If people are in that home, they're quarantining and may have COVID-19, then emergency workers deserve to have that information so they can prepare themselves before they arrive.
But as more people get vaccinated, the need for emergency workers to be prepared for that diminishes. Andrenia Hoff, ABC News, Melbourne.